Hello, my name is Nessa Gilmore. I'm currently attending the health science program at Georgia Highlands College, and I have been researching a topic that's become near and dear to my heart, uh, which are the benefits of interprofessional collaboration in the nursing field. I have been currently practicing as a licensed practicing nurse for 8 years, and so one that values the outcomes of their patients and overall health and making their end of life as happy as possible is me and what I stand for. And so what I've learned about interprofessional collaboration and the benefits is that it's a framework or a structure that is based off of 4 core competencies: ethics and values, communication, roles, responsibilities, and teamwork. And of course, teamwork, because truly there is no I in team. Communication and teamwork are the ultimate or most significant topics of the 4 core competencies, in my opinion. And it cannot happen without teamwork. Truly, we all depend on one another in the nursing field. And these 4 core competencies fall under several sub competencies, which are almost like the guidelines or the rules or the law to what it stands for, and how you should carry yourself as a professional, as a team member, to make this this structure go accordingly and forward moving. Subsequently, it's laying a foundation for healthcare professionals to provide a safe, efficient, effective, patient-centered care based on morals and communication and a clear understanding of your roles, your responsibilities, being a team player, to decrease mishaps and malpractice and injury and even death that occurs every year in the healthcare field due to some form of miscommunication or poor teamwork. However, in interprofessional collaboration, what I did learn through this research is that it does not always work. And that goes by my firsthand personal experience on why it doesn't work. The World Health Organization published a case study that kind of ended in the same results that I was able to discover, and that was based on 6 cases that were in various countries that they did through nursing and midwifery and education, but it happened in Brazil and Canada and United States and so forth, and they came up with the same results. And so there are some barriers that are to be had in the professional field, unfortunately, and that starts with management. Management is, in the health field, is the substructure that oversees that interprofessional collaboration happens successfully. And although they may not be able to make it 100%, they can get close to 90 because we're all human and we're all not perfect. The management team ensures that health protocols and standards and methods of effective communication and training and team building exercises are happen and are significant to ensure that the team is orchestrating patient-centered care, that these guidelines that are presented by the sub-competencies are followed through. And so some of the things that I came up with to ensure some of the successes of interprofessional collaboration is possible implementation. I have to admit, 8 years of being a nurse, I have never heard about interprofessional collaboration in the nursing field until I took the course. So I feel that in order to prevent injury, in order to prevent disease, in order to promote health, that one would have to be subjected to that. And I think that interprofessional collaboration should come as a state training, a federal training, that if federal requires it or state requires it, nurses could hear it more often. And whether that is every 6 months of training and hearing about interprofessional collaboration, having different guidelines that encourage teamwork, training that encourages team building. In order for interprofessional collaboration to truly be successful, education is key. And so I feel that implementing, whether that's through Medicaid and Medicare in order for facilities to receive their funding, or for federal government to offer extra funding and incentives that are required through their healthcare professionals to take interprofessional collaboration training yearly or bi-yearly, would be the best benefit to continue to allow that happen. Not only does the management team have to follow that through, but I think that on a corporate level that these healthcare facilities fall under should have to ensure that this type of training is being had. When you have patients that have a urinary tract infection and you understand their signs and symptoms of what it looks like, as a nurse, you need to be on hand and on board to make sure rehospitalization doesn't happen for something as simple as a urinary tract infection that could be cured by an antibiotic in-house in a facility. And so that requires us to get to know our patients and trust in our patients and trust in the staff, and having a more hands-on approach. Nevertheless, my tool that I feel could be implemented the greatest is, the reminding of the infographics, the reminding of training bi-weekly and yearly for this, because interprofessional collaboration needs to happen more often than it does. Thank you.